Hello, students. So I'm very excited to talk to you today about Parkinson's disease and be doing a guest lecture for you guys. So first off, introductions. So my name is Abhilasha Vishwanath. I'm a first-year graduate student in the Cognitive and Neural Systems program. I am working under Dr. Stephen Cowan, who is your professor for this course. And I've also included my email. Please feel free to email me with any questions that you have about the slides that I'll be presenting today. So, as I said before, I'll be talking to you about Parkinson's disease today. For this presentation, we'll be describing Parkinson's disease, and I'll walk you through some of the symptoms of this disease. And in the next presentation, I'll be going over the treatments used for Parkinson's disease. You guys have been talking about aging and aging-related disorders. So in this slide, I wanted to draw your attention to the prevalence of Parkinson's disease. So according to the Parkinson's Disease Foundation, approximately 1 million Americans and about 10 million people worldwide are currently living with Parkinson's. And to tie it into who are most risk for developing Parkinson's is the statistics where that shows 41 people per 100,000 are affected in their 40s versus 1,900 people per 100,000 are affected um, who are 80 and older. So it gives you a sense of how prevalent it is in the older population. So what is Parkinson's disease? It falls under the class of neurodegenerative disorders. Some people also classify it as a motor disorder due to the significant amount of motor symptoms seen in Parkinson's disease patients. But it is a neurodegenerative disorder, and it is the second most common neurodegenerative disorder after Alzheimer's disease. Neurodegeneration just means significant loss of neurons in the brain, either in particular regions or just throughout the brain or multiple regions of the brain. So in Parkinson's, it's a result of significant loss or degeneration of dopamine producing neurons in the substantia nigra region of the brain, which you can see in the figure at the bottom, highlighted in gray. And so, due to this significant loss, there are some cardinal features of this disease that we will go over in the next slide. Next couple of slides, actually. So now I want you guys to think about what could some of the symptoms of Parkinson's disease look like. So I'm not sure how many of you have seen Parkinson's disease patients or heard of the disease, or just by the knowledge that you have of the importance, complexity of neurotransmitters and their functions in the brain. In this case, dopamine. What would you predict some of the symptoms may be, given that one of the functions of dopamine is to initiate and coordinate movements, and given that Parkinson's disease patients have over 80% loss of the dopamine producing neurons, so there's very little dopamine circulating throughout the brain. So what would those symptoms be? You could stop here, pause for a moment to ponder over that, maybe write it down, and we'll go over the symptoms in the next few slides. The features or symptoms of Parkinson's disease can be broken down broadly into these two categories, that's motor symptoms and non-motor symptoms. We will watch a video and go through some of the specific motor difficulties that these patients suffer from. And we'll also touch on some of the non-motor symptoms towards the end a little bit.
I'm going to have you stop right there, Alice. I'm going to come behind you again and do that pull. Okay, so I'll have you face the wall. You want your feet apart a little bit. And I'm going to give you a tug back. Ready? Check for rigidity again. So I just want to... Okay, now left foot. Really. Okay, and now with the left. Open and close. Keep going. Okay, and now with the left hand. Keep going.
So for motor symptoms, I thought it'd be useful for us to watch a video, and then I will try and point out the four key features of Parkinson's disease in terms of motor symptoms, which is bradykinesia, which is slowness or poverty of movement, muscle rigidity. We'll talk a little bit about cogwheel rigidity after the video, and resting tremors, and postural balance impairment, which is disturbance in gait and prone to falling. So I'm going to start the video and walk through it. Feel free to watch the video as well. So in the video, the patient is asked to walk down the hallway. You can see that she has trouble maintaining balance, walking in a straight line. Her gait, which is her walking, is off center. She has visible disturbances in balance and walking. And the doctor also she gives a push from the back. You can see that she's unable to maintain her balance, and hence she falls back. Next, they look at muscle rigidity, and this also demonstrates slowness of poverty of movement. The patient is asked to tap her feet, tap the toe as fast as possible and as big as possible, but she's unable to do so. That kind of points to the rigidity in the joints and unable to produce such movements. There's also the upper body function where the patient is asked to tap the tips of her fingers together as fast as possible and as big as possible. But over time, she is not able to maintain the amplitude or the speed at which she's asked to do that. And also, there is visible tremors that's just shaking when she's not moving, which you can see when she's sitting on the chair. All of these are cardinal features of Parkinson's disease patients. There are a few others as well, but one of the things that the video doesn't touch on is cogwheel rigidity, which is um, which is a combination of where tremor and rigidity, where at rest or when the person is relaxed, if a slight pressure is put on their arm, for example, uh, there are visible tremors. So it demonstrates rigidity, and as you saw in the video, some tremors, postural balance is another key thing. And Brady dyskinesia is by far the most pervasive symptoms that's seen in all Parkinson's patients, where there's a slowness and poverty of movement. This is mainly due to the loss of dopamine, and patients are not able to initiate movements as easily. So next, we will move on to some non-motor symptoms. So the non-motor symptoms seen in Parkinson's disease is very interesting. These symptoms develop almost 5 years prior to observable, visible motor symptoms that's seen in Parkinson's disease. So right now there's a lot of research being done on these non-motor symptoms that develop way in advance to see if treatment and diagnosis can be made in the very early stages of the disease so that patients have the opportunity to deal with the disease in better ways. So it's very interesting. And some of these non-motor symptoms are sleep problems that patients experience. They also experience some olfactory difficulties or complications, and they often have bowel movement difficulties. And with the Parkinson's disease patients, there's also significant mood disorders related to the the patients. They also have reduced affect as well. Their facial expressions, which kind of relates to some of the motor difficulties, but there is significant mood changes in Parkinson's patients. And another big one is cognitive deficits seen in these patients. Uh, it's a it's a dual effect where patients develop this in later stages in life, and the cognitive difficulties are both related to the key features of Parkinson's disease as well as a normal process of aging. But these non-motor symptoms are interesting, and they come on earlier, and it's a possible route of dealing with this disease more effectively. That's very interesting. So to quickly summarize what we talked about in the presentation today, Parkinson's disease is a neurodegenerative disorder which results from a significant loss of dopamine-producing neurons in the substantia nigra region of the brain. The key motor symptoms are bradykinesia, which is slowness and poverty of movement, muscle rigidity, which prevents patients from freely moving their joints and limbs, and resting tremors, and postural imbalance, which makes them more prone to falling and have gait impairments. Some of the non-motor symptoms that we touched on was sleep problems, cognitive difficulties, and mood disorders, mostly due to loss of dopamine in the brain, among a few others. But these will be the main non-motor symptoms. So I wanted to leave Parkinson's disease symptoms here and pick up next time with treatments available for uh, these patients. Um, it is clearly a prevalent disorder and affects so many, and it's really debilitating, and it's we will look at some of the effective treatment options available. There is no cure, but there are effective treatments, but the mechanism of how they work is interesting, and we'll be covering that next time. So see you then.